We're happy to spend a few minutes at ASCO with our friend Dr. Edith Mitchell from the Kimmel Cancer Center at Thomas Jefferson University in my hometown of Philadelphia. It's always nice to see you.
It's good to see you too, and thank you for having me.
That's a great color on you.
Thank you.
All right, so let's talk about the poster that you have.
So the poster that we had was based on a previous study that we had conducted in the Eastern Cooperative Oncology Group, ECOG, and it was called ECOG 3200. This was a study of bevacizumab with the chemotherapy of oxaliplatin, 5-FU, and leucovorin. And what we showed in this study of ECOG 3200, that bevacizumab added to chemotherapy in the second-line setting for patients with metastatic colon and rectal cancer had benefit. However, when we analyzed the data for the African American patients, it was very clear that the African American patients did not do as well, and we showed that statistically overall survival, progression-free survival, and response rates were all less in the African American population. So to evaluate that further, we analyzed hypermethylation, which has been shown to have a detrimental effect in patients treated with 5-FU, and that has been shown previously, and our work showed that too. So we analyzed both the African American patients and the Caucasian patients according to hypermethylation. What we showed was that if you looked at the median, the average of all of the patients, if the Caucasian patients had values that were lower, and overall survival was improved in those patients with lower values, which goes along with previous data. However, for the African American patients, there was just the opposite. There was improved survival, overall survival, progression-free survival, and response rates in those patients with high hypermethylation. So we're investigating this further to determine if the poor overall survival and higher mortality rate in colorectal cancer could be related to molecular and biological features and characteristics of the disease.
How many patients are you working with?
So in this study, there were 820 patients overall. We had tissue samples on 281 patients. 261 were Caucasian patients and 20 were African Americans. So our efforts are focused on increasing the accrual of African Americans to our clinical trials so that we will have tissue to evaluate and therefore can evaluate the molecular biological characteristics of the disease to try and find an answer or a solution to why African American patients have such higher mortality rates.
You're uniquely qualified in this area and very passionate about it. How is the challenge in getting African Americans to participate in clinical trials like this versus Caucasians?
Well, I look at it as an overall plan, and therefore it's not just convincing the African American patients to participate, but we have to look at the overall feature. In other words, there are research studies demonstrating the fact that patients participate in clinical trials more avidly if the investigator looks like them or have something in common with them. There are also cultural competency issues such that if the investigator has a different background than the patient, there can be some bias in terms of treatment plans or assumptions that can be made. So we've got a long way to go. Cultural competence is a big part of inviting patients to participate in clinical trials, and there are studies showing that African American patients are invited to participate in clinical trials less frequently than Caucasian patients.
Well, you can work on changing that.
Thank you.
Thanks
and thanks for having me.
You got it.